Hello, good morning, afternoon, or evening, depending on where you are at this particular moment. We are coming to you from the African Union headquarters and coming with the Thursday morning briefing of the Africa Centers for Disease Control and Prevention. And that focuses on the COVID-19 response in Africa. It is for the media for you to get updates as well as to put your questions forward to the Director of the Africa CDC, Dr. John Nkengasong. My name is Wayne Musabayana and I'm Head of Communication at the African Union Commission. So Dr. John is traveling, he is on mission. Actually, he is in South Africa. You may recall that last week he was in Rwanda. So our meeting today is going to be a little bit shorter because he has other appointments coming up. And so we will take 50 minutes for this briefing today. For your question and answer session, as usual, please utilize that number +251 94 550 2310. Let me give that to you again, +251 94 550 2310. And of course, as usual, you can come through live as well as send your questions in to the question and answer section. All right, let me now hand over to Dr. John, who is actually coming to us from Cape Town in South Africa for that briefing. Dr. John, I hope you're not too cold in Cape Town and you have the floor.
Thank you, Wayne. It is cold in Cape Town, but just nice weather for a change. Greetings from Cape Town to all of you on this platform this morning, and thank you for always joining this forum every Thursday noon. As usual, I'll do three things. Give you an update on the epidemiological situation across the continent, and then discuss our support for the countries, member states, and then conclude with an update on vaccination. As Wayne said, I've been doing a tour of countries, member states, to really see firsthand what is going on in the field with respect to vaccines and vaccination across our continent, so that we continue to learn from the lessons on the ground and then better organize ourselves to support member states based on the reality. So let's start with the epidemiological situation. As of today, May 27, the continent has reported about 4.7 million cases of COVID-19. That represents about 2.8% of the overall total reported globally. The death rate stands at 129,000 cases, and that represents about 3.7% of the overall deaths. Our case fatality ratio, which is the number of people who have died out of the number of people that have been reported to be COVID infected, stands at 2.7%. The following 5 countries are reporting about 63% of the total number of cases. They include South Africa, 34%, Morocco, 11%, Tunisia, 7%, Ethiopia, 6%, and Egypt, 5%. As I indicated earlier, the global case fatality ratio or rate is 2.1%. If we now look at the variant situation, which we've discussed severally on this forum, 27 countries are reporting the B117 variant, originally identified in the United Kingdom. One additional country has been added to the list, that is Burkina Faso. 47% of our member states, that is 26 countries, are reporting the B1351 variant, originally reported or identified in South Africa. And one additional member state, Tunisia, has been added to this list. So clearly the variants continue to circulate or be identified in many other countries. 18% of our member states or 10 countries are now reporting the B1617 variant, originally reported or identified in India. One additional member state, that is the DRC, has joined the list. If you look at the trends now, as we do every week, we look at the 1 weekly trend and then look at the 4 weeks trend. Between the week of 17 to 23rd of May, we've recorded 69,394 new cases, and this represents a 24% increase from previous week. I'll come back to that shortly to explain this increase because of some regional trends. The highest proportion of new cases is from Southern Africa region with 41%. Again, that explains that sharp increase. Northern Africa, 34%, East Africa, 14%, Central Africa, 7%, and Western Africa, 5%. The highest, the following 5 countries are reporting the highest number of new cases: South Africa with 21,000 cases, Tunisia with 8,000 new cases, Egypt 8,000, Cameroon 3,000, Kenya 3,000. In terms of new deaths, a total of 2,197 new deaths have been reported across the continent, compared to 1,848 from the previous week. This represents a 19% increase previous week. Let's now turn our attention to the last 4 weeks and stretch that and see and compare events that have happened between April 26th and May 23rd. In terms of new cases, we've recorded an overall 0.4 average decrease in new cases. You can see that the sharp increase over the last week has now brought down a number of the trends that we're seeing over the last 4 weeks. So an average of 0.4 average decrease across the continent over the last 4 weeks. The following are the regional trends: 136% increase in the Central Africa region, 21% increase in Southern Africa, 4% decrease in North Africa, 11% decrease in West Africa, 17% decrease in East Africa. In terms of deaths, there have been an overall 1% average increase in new deaths reported over the last 4 weeks. Let's transition to testing. As a continent, we've conducted over 47 million tests. And the good news is that over this week, I'm really happy to see that the continent conducted about 1 million new tests, and that represents an increase of 32%. If you recall, 2 weeks ago, I was making a strong appeal for the continent not to relent on testing. And I'm very encouraged, and I hope this trend will be maintained. The overall positivity rate, however, remains high, about 10.2%, with a test per case ratio of 9.8%. Let's now go to the situation with vaccines and vaccination. As of the 24th of May, 2021, a total of 43 million vaccine doses have been acquired by member states, with approximately 28 million doses being administered. The figure corresponds to a coverage rate of 1.62%, with a slide with about 0.46% of population fully vaccinated. To date, AU member states have used up about 65% of their vaccine supplies, and this represents a 0.8 increase compared to the last briefing. Some numbers, just to highlight some of the progress so far. Morocco has used up 12.7 million doses of vaccines, representing 99% of its supplies. 13% of the population has been fully vaccinated. Ethiopia has used up 1.6 million doses, representing about 67% of its supplies, with 1.5% of the population vaccinated. Kenya has used up 954,000 doses, representing 93% of its supply fully used, with about 1.8% of its population fully vaccinated. So the point of this is that insofar as we have challenges in some countries, I mean, a vast number of countries, including what I briefed you on in Rwanda the other week, making very good progress with respect to use of their vaccines. In South Africa, where I am, tremendous progress has been made. The government has secured enough doses to inoculate the adult population. I was in a very extensive meeting with the Minister of Health 2 days ago, and their numbers are very impressive. If those vaccines can continue to come in and the uptake also complies, then they should be able to achieve their target of immunizing over the adult population, about 70% of their population. As of 25th of May, South Africa had administered about 700,000 COVID vaccines. South Africa has effectively administered around, if you transform that into per 100 population, about 0.9 doses per 100 people in population. This week, the US biotechnology firm Moderna said that in their recent trials, COVID-19 vaccines showed safety and efficacy in adult population age between 12 and 17 years. I think that let me end there, Wayne, and then turn it over to you. Thank you.
Thank you very much. That was our briefing coming from Dr. John Nkengasong. And we move straight into your questions. The first one is coming from Paul Adepoju, and he's writing from Nature. So Paul says, Dr. John, do you consider that COVID-19 is the biggest ever test for the Africa CDC? That's one part of the question. Then he goes on, how do you think that the COVID-19 experience will impact and influence the center's works on other diseases, including HIV and AIDS?
So, Paul, thank you for that question. The short answer to that is yes. It is the biggest challenge we, as Africa CDC, have had in a very short history. If you recall, Africa CDC was launched in January 2017 at the sidelines of the Head of State Summit in Addis Ababa. And in that 4 years, we have been launched straight on into responding to disease outbreaks in several countries, actually in more than 15 countries in a very short history that is prior to COVID-19, but predominantly also in a very sustained manner in North Kivu, where we deployed over 65 responders to support the government of the Democratic Republic of Congo to fight Ebola in North Kivu. And then COVID hit, and it was a massive effort. It was not regional, it was spread all over the continent, and we had to stretch ourselves. But I must say that in this exercise, the political leadership of our continent, at that time last year, headed by President Cyril Ramaphosa, the President of South Africa, and the rotating chair of the African Union last year, and the remarkable leadership of the chairperson of the African Union, Chairperson Moussa Faki, were very determined in guiding Africa CDC and bringing it to the fore. So the challenge was there, but the political support and commitment was also very clearly in play. With respect to the impact that CDC will have going forward, I think there's no doubt that this is a transformative moment for the Africa CDC, where with the political support that it now has across the continent at the highest leadership, It is poised to play a very strong role to enable the continent to fight other endemic diseases, including HIV, TB, and malaria. And that effort will complement nicely the efforts of the World Health Organization, especially the regional offices in Africa. So I think in any crisis, we should always strive to look at, see where the bright side is, and the bright side of this crisis we are facing, which is a generational crisis, and with an unprecedented nature, and with an unpredictable ending, is that Africa CDC will be strengthened to continue to be that strong health security instrument for the continent.
All right, thank you. The next question is coming from Megan Lawrence, and she's welcoming you to Cape Town because that's where she is as well. So she says, why hasn't South Africa received any vaccines via COVAX? Is it because we are mainly receiving AstraZeneca and the country cannot use it? And then she goes on to say, could you maybe shed light on when the country will receive vaccines via COVAX?
So, Megan, feel free to join me live so that we can jointly do this press conference from your home city of Cape Town, a beautiful city. So, South Africa is in discussion, or was in discussion with COVAX. And, you know, South Africa will certainly acquire some vaccines through COVAX based on the arrangements that they had. If you know, the COVAX facility has two dimensions. There are countries that will pay for their vaccines, and those are called the medium income countries, where South Africa and I think Gabon and Botswana seem to be in that category. And other countries were receiving free vaccines because of the status of their own development. But South Africa has acquired more vaccines through their bilateral negotiations, through Pfizer and others, Johnson & Johnson, and enough to cover a large chunk of its population. And if once those vaccines start getting in, there's no doubt that the pace at which the program is now, I just indicated about 700,000 people immunized, but based on the analysis and the discussions I had with the Minister of Health 2 days ago, this is clear indication that the program will pick up very, very quickly once those vaccines start arriving in South Africa. So just to add that South Africa is not predominantly using AstraZeneca. They stopped the first 1 million doses of vaccines that arrived were not used. They were acquired by AVAC and then shipped to other countries because of the variant that we have discussed on this platform.
All right, thank you for that clarification. So Maggie Fick, who is with Reuters, says, what is the priority? Is it wealthy countries donating their excess vaccines, or is it investment, or is investment urgently needed in local production? Then she goes on to say, when do you expect the local production to make an impact? She had 3 questions, but I'll give you those 2 for now.
So what is urgent, and I've said this before, is the need, and I'll add the urgent need for countries that are sitting on excess doses of vaccines to redistribute those vaccines so that we can put vaccines in the arm of our people for the collective interest of humanity, not just Africa, but humanity as a whole. If we delay the process of vaccination, then we will not win the battle against COVID-19. That is very clear. Alongside that, we need to begin to build in parallel local vaccine manufacturing on the continent because we know that targets are huge. This is the first time the continent will be striving to vaccinate so many million of people in a very short time. Second thing, the reason we need to work on local or regional manufacturing is clearly that we just don't know the duration of immunity of the vaccines we are dealing with. In other words, we don't know if they will all require, everyone who has been immunized will need a booster immunization. And if that is the case, then it means the vaccination will continue to occur on almost a routine or yearly basis to maintain the level of immunity. And because of that, we can not rely entirely on facilities outside of the continent. We need to rely on our own regional capacity and capabilities. And that is the basis of why, if you recall, we organized a vaccine summit on the 12th and 13th of April this year, which was very, very successfully attended by over 40,000 people in 2 days. So I think the short answer to your question is we need those countries that are sitting on excess vaccines to redistribute quickly. We need those countries that have pledged that they will redistribute excess vaccines to do that quickly as well. But clearly do that in a coordinated fashion so that we collectively as a continent move to achieve a 60%, at least 60% threshold that our continental strategy has established.
Thank you. The next question is also about South Africa, and it's coming from Andrew Meldrum. And he says, is South Africa starting to see a third surge?
We look at the data yesterday carefully with Professor Slim Karim and others, and the answer is yes, we are beginning to see a slight urge creeping up of the infections. So that points to the fact that we may and just may be edging towards the third wave in South Africa and other countries. If you look at it, the statistics from neighboring countries as well.
Adis Getachew, who is the correspondent for Anadolu Agency, says that with less than 2% of the population in Africa having been vaccinated, how can the continent expect to meet the planned target of 60% that will be considered the minimum towards population immunity?
Yeah, you're absolutely right. We are not winning the battle against COVID vaccination in Africa, clearly so. I mean, with the rate of this immunization, we are lagging behind. And I think that is why I continue to appeal to the friends of Africa, our partners, and the world to consider this as a collective security issue that needs to be addressed from all corners of the world and not just in some parts of the world. So if we keep vaccinating at this pace, we are not going to achieve our target of vaccinating at least 60% of our population by the end of 2022. And that would delay our ability to eliminate the virus from our population. And my greatest concern is that then we might actually begin to move towards endemicity of this virus on the continent.
All right, let's go live and take a question from Sophie Mukwena. And Sophie is with South African Broadcasting Corporation. Good morning, Sophie.
Good morning and welcome, Dr. Nkengasong in South Africa. Doctor, can you tell us the reason for your visit to South Africa? And secondly, on issues around manufacturing of vaccines, drugs, and therapeutics. Last week, during the meeting of African heads of state and France in Paris, President Macron made a commitment to assist the continent in building capacity on manufacturing of vaccines. In terms of the CDC, the update, and also when President Addo was addressing the Pan-African Parliament, he indicated that countries such as South Africa, Ghana, Kenya, Senegal, Rwanda have capacity, including Nigeria, to do just that. How far are we? Can we perhaps very soon see a country that will launch such facilities or such capabilities? And finally, this morning, the Pan-African Parliament, one staff member tested positive for COVID-19. This issue of the gathering and leaders who are supposed to lead by example, what's your view? Because clearly it was bound to be a super spreader.
Yeah, thank you, Sophie, and always a pleasure to be in your beautiful country. And I was hoping that you join me live from here so that we can do the press conference together. So I'm hoping that next time we'll probably do it in your studio. So I'm here for two reasons. One is as I indicated earlier, to understand the situation of vaccination and vaccine acquisition in South Africa. Our philosophy at Africa CDC is that our interaction with the countries have to be mutual, which is we learn from the countries and share those experiences across Africa, across our 55 member states. In the last 3 weeks, I've been in Cameroon, in Rwanda, and now in South Africa, just to continue to learn those lessons, and also to emphasize the message of the need to not lower our guards because we are talking about vaccines, but to continue to emphasize and promote the need for public health measures. And on that note, I'm also meeting with some private sector actors in South Africa that will enable us to develop the right partnerships for the public health measures, like the MTN. We had a very good meeting and productive meeting with the leadership of MTN, and we are looking at developing a partnership to promote mask and continue wearing of masks using the MTN connections and networks so that we do not lower our guards and be complacent with the fact that they talk about vaccine, but the vaccination on the continent, as I indicated, is still very limited. So the best tool that we still have in our hands is public health measures. I think that is one. The second reason I'm here is really to look at local vaccine manufacturing. 2 days ago, I was at the Aspen facility, spent the whole day there looking at the production of the Johnson & Johnson vaccines. There is the cap and fill, and actually had that emotional joy to see, to have a vial of the vaccine in my hand in the production chain. And that, and when I heard that vial in my hand, what went through my mind was this vial is going to save 5 lives, because in each of those vials, you could immunize 5 people. And I think that was really, heartwarming. And my message to them is that we need to sort that out quickly so that those viruses can begin to get into the arms of people. But believe me, it was quite an emotional moment to be there. As we speak today and now, I'm talking to you live from Baobab, where we are discussing also very similarly on what is it that they can do now. Now meaning in the next couple of months, not years, so that we can actually get vaccines production happening here. Vaccine production, Sophie, is a spectrum where you look at research and development and the product development, and as well as the manufacturing at scale. So we are looking at the value chain and say, where is it in the value chain that groups like Baobab can actually intervene now to be helpful in the dicey vaccine situation for COVID that we find ourselves in. So that is one conversation that I'm having with them. And then tomorrow I will join a small meeting with the president of France to continue to discuss the vaccine manufacturing agenda on the continent. As you recall, the EU announced a $1.2 billion manufacturing package for the continent, and those discussions I'll continue to have that with the leadership of the French president, who invited me to join that discussion in a very small group, and other leaders there. So that's why I'm here in South Africa to continue to engage in our COVID response efforts.
Thank you for that. Now let's move on to Katarina Hohi, who is with Bloomberg. And Katarina says, I'm wondering when South Africa will reach its target of vaccinating 70% of its adult population. You referred to this point a bit earlier, so she wants to know, when do you think the country might get to that point?
I think there are several factors that are in play that will all need to come together to enable South Africa to get there. One is the speed at which the vaccines that they've acquired will come to the country. Then the second is the cooperation of the population and what I usually refer to as community ownership and community engagement. And civil society, so that they can actually facilitate the demand creation. I think those are factors, those two elements will need to come together to accelerate uptake of the vaccines in South Africa. So again, the formula we've expressed at Africa CDC is clear: vaccines plus vaccination equals life saved. So we have to look at the vaccine as a product, but vaccination, which has several elements. And South Africa has developed a public-private sector partnership that will also bring in the private sector to help in scaling up vaccine. So I think each country will need to innovate itself in that space of vaccine uptake in the vaccination pillar. I mean, when I was in Rwanda 2 weeks ago, it was a question of bringing in the whole of government, where the military came in, helped with the distribution of the vaccines to remote areas and areas of need. And so every country will need to come out with some innovative approaches to facilitate the uptake of vaccines once they are there.
Thank you very much. Della Russell.
Maybe I should just add, when that my appeal to all our member states is that be shuffle ready, so that when vaccines arrive, you use them quickly, because this virus is, we are not winning the battle against this virus. As we keep seeing, for example, South Africa go through the first wave and the second wave and the third wave, and each wave is often more severe than the previous wave. So we are not winning the battle against this virus. So it requires that every member state has to have a shovel-ready plan, so that when vaccines come in, they immediately use them to immunize our population. Each time you put that needle in the arm of any individual, you're saving lives.
Thank you very much. Let's go to Della Russell, who's writing from the Daily Graphic in Ghana. And she says, I came across information that suggested that of the 1.2 billion doses of COVID-19 vaccines that have been administered globally, only 3.7% have been administered in Africa. And there is a projection that the percentage may drop even further in the next 14 days as stocks from COVAX remain unsecured. So the question then is, how will this impact on the continent's post-pandemic recovery?
It's a very good question, Dela. As I indicated, as a continent, we have now secured about 43 million doses of vaccines. So if you put that, you do the maths with respect to the 1.3 billion doses in the world, it can give you the right proportion. Any delay in our vaccination is going to cost us not just lives, but our economies. I mean, because if you take the case of South Africa, if the projection or the trends we are seeing are maintained, then South Africa would naturally go through a third wave, and that will require other drastic measures that will restrict the movement of people, restrict the tourist industry, restrict so many things in economic development. So that continues to impact our economy and, of course, life saved. Vaccines are the most potent tool for our economic recovery, period. I don't know how else to put it there. I mean, if we want to recover our economies, we have to invest in vaccines, and at scale and at speed. I've always said there are three things we need to do on a continent to come out of this. One is fairness in vaccine distribution. Second is the speed of vaccination, and third is the scale of vaccination. We have to do all three things, and that, of course, becomes a serious economic imperative for us to do, and do it quickly.
All right, let's now say hello to Rhoda Odhiambo, who is coming to us live. Rhoda, I believe you're with the BBC. Please go ahead with your question.
Hi, Wayne. Thank you so much for taking my question. Yes, I'm with the BBC. I'd like to ask Dr. Nkengasong. So many African countries are redistributing vaccines to other countries that seem to have a good uptake. And this is because countries are struggling to vaccinate people because of widespread misinformation and other people being skeptical and others are hesitant. So what help can Africa CDC offer to countries to ensure that the vaccines are used and not redistributed as we are seeing? Because if the continent is really lagging behind in terms of vaccinating people and it wants to achieve herd immunity, according to the time frame that was set, what help can the Africa CDC offer countries? Because governments now need to be held accountable.
Rhoda, that is a very, very good question. And I must say that the Africa CDC is already providing training to several countries in the areas of vaccination. Okay, and that includes the whole social science component of that. We've seen in this pandemic that behavioral change is critical, and it will continue to be so for the ability to use vaccines. We did a perception survey, which you recall, we discussed it several months ago, where we look at 15 countries in Africa with respect to, and the fundamental question was, if a vaccine was available today, would you take it? The range of acceptability was from 59% to about 95%. Because of all the noises that have gone around vaccines in Africa, vaccines as a whole in the world, the whole issues around AstraZeneca vaccines, where the European countries posed it and then started using it again, and the Johnson & Johnson, that rate you can imagine, that is the rate of acceptability fluctuates. But it's not static. I mean, we've seen in Nigeria where initially the perception or the willingness to take vaccines dropped, but then as vaccination increased, that rate also increased. So what is Africa CDC doing? A couple of things. We have training programs that are ongoing for vaccinations. Secondly, as I just indicated, we'll be launching a campaign across the continent on not just public health measures, but on to mobilize the communities on the need to use vaccines and to uptake vaccines, and that vaccines save, and vaccines save life. So vaccines are safe and they save life. I think it's extremely important, and that by vaccinating oneself, you're also protecting your loved ones from being infected. I think that is extremely important. In the coming weeks, you see more and more of these campaigns going on across the continent, and we count on you all, I mean, to join forces in this. It's not only a public health agency's responsibility, but it's collective responsibility to spread the right information. What is keeping people at bay from using vaccine is misinformation and inaccurate information. These vaccines are safe. I have been vaccinated. I mean, I have not fallen sick other than the very basic effects you have after vaccination, which is you may develop your arm, may swell a little bit, you may have a fever, but that all means that the vaccine is working. So I have been vaccinated, you go get your vaccines, and let's get the continent vaccinated.
All right, in the last few minutes, let's go back to the question from Maggie Fick, and this will be the last one. And Maggie is writing from Reuters. So she's going back to the issue of the statement from the European Union that it will invest 1 billion euros to build vaccine manufacturing hubs in Africa. So firstly, she says, what is the Africa CDC's response to this initiative? And then she goes on to say, is the Africa CDC in agreement with the hubs that have been identified by the EU, such as South Africa, Senegal, Egypt, Morocco, and Rwanda? And finally, she says, is the Africa CDC aiming to coordinate efforts to ensure that research is focused, for example, to manufacture certain specific vaccines in certain hubs or countries?
So first of all, let's welcome the good news. The good news is the announcement made last week at the Global Health Summit in Rome, which the EU announced the $1.2 billion commitment to support our partnership for African vaccine manufacturing. in abbreviation PAM. If you recall, one major outcome of the April 12 and 13 summit, vaccine summit that CDC and the African Union co-organized was an announcement by President Tshisekedi, who is the president of the African Union, the rotating president of the African Union, excuse me, that the continent will be embarking on a partnership for African vaccine manufacturing. A framework is being developed for that, and a framework that calls on two things. One is that we look at a stepwise approach to vaccine manufacturing so that in the next 20 years or 25 years, Africa begins to manufacture at least 60% of its vaccines rather than importing 99% of the vaccines. We consume 25% of all vaccines in the world, so that cannot continue to be the case if we have to guarantee the health security of our people. I think that is one. So that announcement, if you read that announcement, it clearly refers to the partnership for African vaccine manufacturing that was announced on April 12 and 13. Now, with respect to the different countries, I have not seen the details of that announcement. I'm hoping to see the details. I think it will be for us Africans to sit down and have a comprehensive conversation on how that will work. And after understanding the details of what is in that announcement, then deciding on how to organize ourselves. We have to look at the whole value chain of vaccine manufacturing in Africa so that we go in as a continent in an organized way and go in a way that countries can play a specific role in that ecosystem so that we do not come out finding ourselves doing the same thing, say several countries doing the same thing, that will not help us. I think that is with the role of the Africa CDC and the role of the African Union in that effort. But I must say that we salute that announcement, and we are looking for more partnerships on the continent so that this can truly be a pivotal moment for the continent to begin to gain its vaccines security independence.
Thank you very, very much for all those remarks, Dr. John. So now it is time for you to give us your main headline points as takeaways from today's briefing.
I think the two messages that I'd like to leave with the audience today is, one is that we need to promote our adapted strategy, continental strategy. Our adapted strategy calls for prevention, monitoring, and treatment, what we abbreviated as the PMT. Underneath prevention, we have two key things there. One is our need to continue to enhance our public health measures and also embark on vaccination. Second, under monitoring is that surveillance has to be increased so that we look at the hotspots as much as possible. And then, of course, surveillance for the variants. We've seen that some of these variants actually challenge our vaccination program. And thirdly, an appeal to all countries that having enough oxygen supply is critical so that we do not find ourselves in a situation that we are challenged like what we've seen happening in India. That is very, very important there. And lastly is that local manufacturing is clearly the medium to long-term solution. That what is urgent now and critically urgent is for countries sitting on excess doses to redistribute and redistribute quickly so that we can put vaccines in the arm of our people. And our people should understand that is the people of Africa should understand that these vaccines are safe. By having a safe vaccines, you are ensuring that your neighbor is safe, your loved one are safe. So I urge everyone that has access to going to a vaccination center to quickly do so that we can continue to protect ourselves and protect our loved ones.
Thank you very much. That was Dr. John Nkengasong, the director of the Africa CDC, speaking to us from Cape Town in South Africa. where he's continuing on his mission for assessment in the different African countries. And he has given us some of the findings that he has made and some of the very critical discussions that he's having with different stakeholders in South Africa. So we wish you the best in that effort. For colleagues who are joining us, who are in the media and other communications sectors, thank you for joining us, and we meet again next week at the same time. Bye-bye for now.
Thank you.